It is Monday, March 22nd, and of course, so many all over the nation and the world today. All eyes on America after a historic healthcare reform bill passes in the House, and a lot of people are wondering how is this going to affect their healthcare? How will it affect how they get treated at facilities? And we're actually at Pocono Medical Center right now in Monroe County, and you're all right. I want to introduce you to Jeffrey Roach. If you could just take a seat here, because Jeffrey, you are a spokesperson for the hospital. For people who are wondering, what does this mean for my healthcare? What is the bottom line for healthcare facilities like Pocono Medical Center?
Ryan, it's really important to know that healthcare reform has focused on the insurance side. It has not necessarily focused on how care is delivered. So what it means for Pocono Medical Center is that we have already taken steps to enact reform right here at our own hospital. And what I mean by that is that quality of care is always our priority. Our patients are always our priority. So quality of care, and then we also want to take steps to ensure that, that the quality care is there, but then also that the better coordination of services occur. And what that means is that patients can get to the services that they need through an easy process to ensure that they get the care that they need.
And I think some people are wondering too, emergency rooms, which are always packed with people. Does the reform actually, will that help, emergency rooms? Will that drop the number of people using them? Because some folks say that this will allow them to get treated at other places and focus on wellness and take preventative steps. What's your thoughts?
Well, what I can tell you is this. We provide $10 million in uncompensated care to the and underinsured right here in our community. Many of those individuals do have to use the emergency room for their primary care visit. And that's because they do not have insurance to be able to see a physician, since many physicians take insurance. However, with that said, we will not know right at this moment whether or not that will reduce the number. There's quite a potential that it would. But what we're hoping is that certainly it will give more people, since it's going to cover 32 additional millions of people who will then have insurance, the opportunity to see doctors and patients during their visits.
And I think that's what's amazing, because everybody wants the instant analysis, as we call it now. They want to know how it will affect hospitals and people, but some of this stuff isn't even going into an effect for a few years. Some of it is immediate. One last question. Someone who works in a hospital daily, you hear so many stories of insurance struggles and things of that nature. For people such as cancer patients alone, you've heard a specific story. One woman actually capped out on her coverage, so how will this reform sort of help her?
Well, one of the things that you're seeing in the reform is that they're going to offer an opportunity for people to no longer have a cap on their insurance. So in some cases, there can be an opportunity where someone may reach a cap for the treatment that they're receiving, whether it may be drug treatment or it may be something else along those lines. And one of the initiatives through this legislation is that they're going to remove that cap. And that can certainly be a benefit to those individuals who are going through some of the most trying times that they're facing. And I think that that's what's most important for people to understand, is that, again, hospitals have already taken steps to address reform, and we're going to continue to do that, because it's all about the better coordination for our patients.
All right, Jeffrey, thanks you. And of course, let us know what you think. You can continue to weigh in on my Facebook, my Twitter pages. Your thoughts are important, and we'll continue to share them with everybody. Have a good day.